Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, listeners. I'm Lindsay Smith Rogers, producer of Public Health on Call. Since March 3rd, 2020, Public Health on Call has brought you more than 400 episodes with evidence and experts to help unpack the day's COVID-19 and public health news and what it means for tomorrow. As we wind down Season 4, we have a few thank yous. First, a big thank you to our interns Kelly Corcoran, Caroline Wang, Alyssa Tsu, and Hannah Bennett, who bring fresh ideas and much-needed support for the podcast. We'd also like to thank you, our listeners, for sharing your ideas and questions and for downloading this podcast more than 6 million times. We're taking a break starting December 23rd, and we'll be back on January 3rd with Season 5 of Public Health on Call. We'll continue to cover the latest on COVID vaccines, treatment breakthroughs, and research. We'll talk about living with COVID and what our world might look like going forward as we move from pandemic crisis to endemic virus. We'll also cover other urgent public health issues, including racism, gun violence, mental health, climate change, and overdose. We so appreciate all the great ideas that come from our listeners, so please keep writing us at publichealthquestion@jhu.edu, and thank you for being part of this podcast. Today, Stephanie Desmond talks to two Johns Hopkins vaccine experts, Anna Durbin and Bill Moss, about why many regions of the world have vaccinated so few people against COVID-19 and whether 2022 will bring changes. They also talk about the value of boosters in light of the new Omicron variant. Let's listen.
Anna Durbin and Bill Moss, thanks so much for joining me.
Oh, it's my pleasure.
Thank you.
So I want to start with you, Anna. We are just hearing about the Omicron variant, and I'm curious what we know about vaccines and this new variant, which has many mutations.
Right. Well, I will say it's very early days, so we don't know a whole lot. We know that the variant has multiple mutations, but I do want to stress that it is still the spike protein of SARS-CoV-2. So although there are many mutations, there's still many parts of the protein that are the same that are contained in the vaccine. So although we may see, and I'm predicting that we likely will see, that antibodies don't neutralize or kill the virus as well as it might the original strain, I do think that you will have what we call memory, that because you've been vaccinated, your immune response will recognize parts of that Omicron virus and that it will provide some protection. The big key is right now, we don't know how much. And I think that's some of the data that we're waiting to come in terms of how severe these Omicron infections are in vaccinated and unvaccinated people and how transmissible it is.
So I'm hearing, Bill, that we should all run out and get boosters now that we have Omicron. And I'm wondering how you feel about that.
Yes, now everyone older than 18 is eligible for boosters here in the United States. And, I was one of the people who didn't really see the full evidence justifying boosters in young, healthy adults. But I do think this is a special circumstance. As Anna said, we have a lot to learn. But we do know from other variants that, such as the Delta variant, that higher levels of neutralizing antibodies provide improved protection and increase the vaccine effectiveness. So it is I think it's a precautionary measure in a way now. Booster doses will increase neutralizing antibodies. I think we know that. What we don't know is how long that boost will really last. But as we're facing, the Omicron variant around the world and here in the United States, I think it's a reasonable suggestion in the absence of real evidence, and we're going to have some of that evidence in the coming weeks, to encourage everyone to get boosters. I do want to point out, too, that the biggest threat right now in the United States at this moment is the Delta variant. And we're still seeing, 80,000 cases a day, 800 or so, deaths a day. And booster doses, may play a role in helping at least reduce those somewhat as well.
As we move toward 2022, I look at places like Africa, for example, Anna, that where the number of people who are vaccinated is very, very low. And so I'm wondering sort of where that leaves us and what we might see going forward.
No, I think that's an excellent question. And I think that's everybody's concern, is that until we get the world vaccinated, we're going to continue to see new variants arise. And it's very concerning. I think globally, we need to do a much, much better job in getting these highly, highly effective vaccines and these vaccine technologies to parts of the world that they can produce the vaccine and deliver it to their own population. I will say there's also, just like here in the United States, a lot of misinformation and disinformation and vaccine hesitancy. And I think we have to work on that as well globally and in different parts of the world to ensure that when vaccines are available, they will be used, because we will not stop new variants until we get the world vaccinated.
Bill, tell me a little bit about how a lack of vaccination can actually contribute to more variants.
Yeah, so really, it's as simple as the more opportunities this virus has to be transmitted, the more opportunities we're giving it to develop mutations. And viruses mutate all the time. This is not something unique to this virus. All the viruses, and this virus in particular, they're mutating all the time. Most of the mutations are actually not helpful to the virus and are kind of dead-end mutations. But a mutation or a combination of mutations can result that make the virus more transmissible, that could obviously, make the virus evade our immune response. Those are advantageous mutations to the virus, and those are the ones that are then going to persist as virus transmission goes forward. So as long as there are susceptible individuals and we're providing the virus opportunities to be transmitted, we're going to be providing this virus opportunities to mutate and potentially develop mutations that are harmful to us, but advantageous to the virus.
I was just going to add to that. And the key is that the longer the virus can replicate or reproduce within a host, then the more opportunity for mutations to occur.
That's a scary scenario, Bill, that you just laid out. To me, it sounds like this is going to get all of us.
Well, no, that's a good point. And the caveat is that there isn't an infinite variety of mutations that are going to be advantageous to the virus. There are evolutionary constraints on viral evolution as well. The virus through the spike protein, needs to bind to the receptors on our cells in order to get into our cells and replicate. So, mutations that may really evade our immune system, but that hinder the virus's ability to attach to our cellular receptors, those mutations are not going to go forward. So there are constraints. We're not going to be facing an infinite number of variants that are more transmissible, going forward, and it's just kind of an arms race going forward. There are evolutionary constraints on the virus, and I would think that at some point the virus is going to probably hit this kind of optimal combination of mutations and kind of settle on that.
So this thing isn't ending anytime soon.
It's not ending anytime soon, but there will be a slowdown at some point. I think we will reach a truce with them. We won't beat this virus, but we'll reach a truce.
Détente.
Détente.
And I wanted to go back to Africa with you a little bit. So we have discussed about how there is very little vaccination being done over there, also parts of Asia as well. Talk to me about why. Is there a shortage of vaccines, Are there poor distribution methods? Are wealthy countries hoarding them? What's the story?
So it's a little bit of everything, but I will say the largest driving factor is that the vaccines just aren't available. The highly effective mRNA vaccines, even some of the adeno-vectored vaccines, they aren't available. They aren't being provided in large enough numbers to these countries. To be frank with you, I think both Pfizer and Moderna are really focusing on selling these vaccines to higher income countries instead of providing them at very low cost to low and middle income countries who really need them. There are some inactivated vaccines that are being provided. However, those have been shown to be much less effective and of much shorter duration of effectiveness than the mRNA vaccines and the adenovectored vaccines. Distribution is a problem. However, as they've improved the stability of these vaccines and the storage conditions of these vaccines, those distribution concerns have been lessened. There is a lot of also vaccine hesitancy, just as there's misinformation, disinformation here in the US about vaccines. It's very prevalent, and it's not unique to COVID vaccines. There have been issues around polio vaccines in Africa and misinformation and different disinformation. So it is multifactorial. However, I think if we could really, and this won't happen in the short term, which is unfortunate, but as I work to think about what's going to happen in the future, long term, what do we need? I think we really need regional production facilities for vaccines for situations like this pandemic, because until we get the world vaccinated, we're going to continue to see the emergence of new variants.
And Stephanie, I'll just highlight what Anna just said. Early on, when we were rolling out vaccines here in the United States, I had this kind of simple way of thinking about, what makes a successful vaccination kind of campaign. And I referred to the 4 Ds, and I think these are applicable in Africa: doses, delivery, demand, and data. And so you need to have the doses available, the supply. And as Anna said, that's one of the biggest problems in sub-Saharan Africa, particularly with the delays in the COVAX getting vaccines to the low-income countries. Delivery, once the vaccines are in country, countries need to be able to deliver those. And this is not an easy lift. And so countries need to have the cold chains and the personnel to be able to deliver these vaccines. And that too can be a challenge in some resource-limited settings. The demand side, having the demand, and as Anna said, addressing the misinformation and disinformation. And then one also needs good data to be able to track, who's being vaccinated, particularly with a multi-dose vaccine. When did they get the first dose, and when are they due for the second? And and for at a national level, just being able to track whether you're reaching the vulnerable populations or the target populations that you want to.
Any thoughts on how we can make sure that happens?
I think it is going to require continued efforts and just, campaigning. And there's a lot of, I will say, there's a lot of resistance, particularly from these large vaccine manufacturers, to share their technology. I think that is a mistake. Now, as public health practitioners and public health officials, I think it is incumbent upon us to continue to raise this issue and to see moving forward. I think there is going to be and continues to be investigations and looking into this pandemic and what could we do better? What should we do next? And I think the biggest question is, how do we ensure there's equitable access and distribution of vaccines globally? It doesn't just benefit countries in Africa and Asia. It benefits everyone in the world, because we need to stop the virus everywhere.
And what I would hope, Stephanie, is, I think there are going to be some, short-term or medium-term things that need to be done to get COVID-19 under control. But I'm hoping, too, that this will result in longer-term investment. So with the next pandemic, we're not in the same situation. Coming back to a point Anna made earlier, there needs to be vaccine manufacturing capacity in all regions of the world so that they're not dependent on the high-income countries outside the region. There's going to be a need for longer-term investment in building the capacity for vaccine manufacturing and distribution, addressing the vaccine hesitancy issues, which have been in parts of sub-Saharan Africa, but not to the extent that we're seeing now with COVID-19. So all of these they'll have kind of shorter term strategies to get us through the worst of the pandemic, but they need to result in long-term infrastructure and capacity building.
One last thing, all this talk that we've been having about vaccines, and I guess we're seeing in some places that the rates of COVID cases and deaths are higher than ever, even though we have a vaccine that is very effective. Why, Bill, are we having that?
Yes, well, there are a number of factors that contribute to that, but certainly there are still a large proportions here in the United States and around the world of people who are unvaccinated. So I would say the number one thing is to get, to raise vaccination coverage. Some countries are doing quite well on that, but most of the world is still lagging, and we're certainly still lagging here in the United States. The other thing that happens is, are our behaviors. I mean, we can prevent transmission of any SARS-CoV-2 variant, no matter how many mutations it has, by wearing masks and distancing. Now, I agree, lockdowns and closing schools and workplaces and travel has huge economic and social costs. But I think even with just the basic public health measures that we can take, we can help control virus transmission. So it's the combination of basic public health measures and vaccination.
Anna, can I give you the last word?
No, I could not agree with Bill more. And I think where you're seeing it, particularly here in the US, is where you have pockets of unvaccinated people where it can spread. And, the Delta variant in particular, we know is highly transmissible, can grow to higher titers within, the host, unvaccinated host. So again, it's a combination of things. Unvaccinated people with a variant, the Delta variant, that has learned to adapt to people very, very well. And, we can only hope that Omicron is not as effective in terms of its transmission and replication as Delta. And I think only time will tell. I mean, we have to really look and see what's going on with Omicron in Africa and other places where it's traveled.
Anna Durbin, Bill Moss, thanks so much for joining me.
You're welcome. Thank you, Stephanie.
Thank you, Stephanie.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holes Fernandez and Caroline Wong. Thank you for listening.